What would you say is the biggest benefit of going through an independent broker as opposed to just looking at Medicare.gov and going, oh my God, I'm going to do all this myself? Not to mention the login challenge that it is just to get an account and get in there every time. What are some of the benefits of working through an independent agent?
Yeah, I mean, we have access to a lot of information that I feel like people don't necessarily know. We can see the ratings of companies. We can see, their loss ratios. We can see how their rate increases have been over the years. And I think recently with Medicare.gov, the pricing has not been accurate. I saw the other day in Arizona, I was looking at a plan in. They had seen it on Medicare.gov with a certain carrier for $133. On the carrier's site, it was $241.
Wow.
So if you're going directly based off of that, you're going to be running in circles, going down a rabbit hole, trying to figure out which one is accurate, which one do you actually want. You might have wanted that specific carrier for $133, but you can't afford $241. We're going to be able to see all those things and help you. Instead of going website to website, we can see it all right there and help you decide that.
Would you say there's some inside baseball knowledge about what goes on behind the scenes at carriers, both processing applications and maybe even claims, or their ratings behind the scenes, enter turmoil if they're being bought by another company? Do you think that inside knowledge could be a benefit to somebody who otherwise would just have Medicare.gov, which is very often unreliable when it comes to supplements?
Definitely. We had a certain carrier that was, taking 6 weeks to process an application. We checked on those applications weekly to make sure that they were getting processed. We called, waited on hold. I myself was on hold for 20 hours for one policy just to make sure that it went through. I can't imagine someone having to do that on their own and just being scared that their policy is not going to go through. Having not one person to speak to, but having to speak to a different person every time they call in. I can't imagine how stressful and just upsetting that would be, not to know where you stand with that policy and not to know that you have other options. So that's where we come in. We have a full team of administrative assistants who can help us. They wait on hold. They do that job for us, which we're so very grateful for. But
sounds great, but how much does it cost to go through an agent as opposed to doing it myself?
it is free. So the insurance companies actually pay us. Just to be, fully transparent about that, the insurance companies do pay us. And, there's not one insurance company we all get paid equally. We're not going to suggest a carrier because they are paying more, paying less. You really have nothing to lose and everything to gain by going with an agent.
If they go through the year and they have trouble with their plan, or they're trying to change their billing method, or trying to reach somebody at the home office for an answer, can they still reach out to us after we've written their application?
Yes, I give every single one of my clients my email, and I still answer emails for people, who have been on the plan for 2 years. Maybe they forgot how something works and they just want to go through it again. Maybe they want to review. And we actually do reach out every year on your renewal date, which for supplements, that's the date that you signed up for it. Every year on that date is when your increase, if you're going to get one, is going to happen. So we like to reach out. If it was a big increase, maybe you want to look around, maybe you want to change. If not, then you can stay put on that plan. But we do reach out every year just to make sure that our clients are still happy with their plans. If they have any questions, we answer them.
You bring up a really good point. So many people think that they can only change their Medicare Supplement plan during the annual election period, which everybody's doing Medicare Advantage. So we have thousands, literally thousands of clients who they think that they want to change their Medicare Supplement, or maybe they signed up for the supplement for the first time during that last quarter of the year. And then everybody gets so busy, or they can't get through on a phone line because, like this year, millions of people lost their Medicare Advantage. It was just so busy that now we get into January, February, March, and April when our call volume goes really down a lot. And that would be a really good time because, again, like Hannah said, you can change and shop your Medicare Supplement any time of the year. So during that non-peak time of Medicare is a really good time to look in the market and see if there's something that's same coverage, maybe even the same exact plan letter, but a big difference in the premium. Hannah, thanks for being with me.
Yes, sir. Thank you.
Stay tuned, stay subscribed, or subscribe if you haven't already. And if you are, stay subscribed. We'll talk to you soon. Bye-bye.